There are three digital opportunities that I'd like to talk about. The first of these is getting shared care records into the A&E department in hospitals. This is really important because currently when a patient presents in A&E, the hospital doctors and nurses know very little about them. There's no information held there. Getting that information into an A&E environment will really help to improve clinical safety and the quality of care for those patients. The second opportunity is shared care plans. Patients who are elderly or frail or who are living with different complex conditions will routinely have contact with a lot of different services. So the shared care plan is a living document which helps those services coordinate their care around a patient. And it helps patients because they don't have to tell their story multiple times to different providers. The third opportunity is around using digital platforms to access general practice. General practice is really busy at the moment, huge demand from patients. So there are a number of platforms available at the moment to help patients access their practice digitally. One of these is the NHS app, and another one is online consultations, which allows patients to message a practice and the practice to message them back.
Today I'm here to talk about the exciting opportunity to improve communication for end-of-life and palliative patients across the Scarborough and Rydale and Vale of York CCGs. This is called an EPaCC system, so end-of-life palliative care coordination system. When I talk to patients, they are always surprised that communication between health and social care providers isn't as good as they think it is. This system will allow providers such as the hospital, the hospice, general practice, out of hours, the 999 service, to see specific information around their end-of-life journey. This information is crucial for the care provider contacting the patient to know their choices and wishes in end-of-life care. For example, place of care, be it home or hospice. This service is supported and funded by the Yorkshire Humber Care Record.
The Yorkshire Humber Care Record is delivering real benefits to our patients across the region already at the moment. It connects up GP systems to local hospitals. You could go see your specialist one day, the very next day the GP's got access to that information to help provide better care for you, increase the accuracy, reduce medication errors, reduce duplication. It also makes things easier for those teams looking after you. They don't need to go searching for the information. It's all there in one place. That's just one way that digital is helping us do a better job for patients in our area. There's loads of other ways that that's going on as well. For example, bringing those clinical systems that GPs use into care homes, so they've got access when they go visit patients there, but also that the teams already in the care homes can see that information, and that's really important to help know about these complex patients and how we can better care for them. We're upgrading our IT systems all the time to help with cyber security, keeping information safe, making sure when you go see your GP that the systems are all working. So loads of things going on in primary care digitally to help provide better care each and every day.